Everyone has the notion that unless you measure something, you really can't affect performance. For me, there may be 4 or 5 high-level key performance indicators, but for the IT operation, there are over 100. I'm Dr. John Halamka, and I'm the Chief Information Officer of Beth Israel Deaconess Medical Center in Boston. We are a Harvard-affiliated hospital with 22,000 employees, 3,000 doctors, 6,000 nurses, 500 IT staff. On the one hand, I'm held accountable for keeping every byte of data secure and all the systems totally reliable, while at the same time constantly changing, constantly improving, and constantly being agile. You'd think, as the top technology professional of a major academic medical center, that I would make decisions. But the reality is, my stakeholders make the decisions. And they're doctors, they're nurses, they're social workers, they're pharmacists. They come together and they look at our metrics and they decide what we should do. I'm a strategic partner at the table to make all these decisions. We want to measure outcomes. Today, we're mostly measuring the process. For example, what we've done is a suite of mobile apps for our senior execs, such that they can pull out their phone and say, I see that the NICU is over capacity, but OBGYN is slow at the moment, and the ER has 32 people of this nature. So oddly enough, one of my most important KPIs is using the systems I create. Just being accountable for a set of KPIs isn't quite enough. I have to go beyond. The first experience I have every day that assesses whether or not we're delivering to the customer what it is the customer really needs. Whether they're machine learning, mobile apps, cloud-hosted decision support services. There's a lot of myth that if you share data with patients, or if you share KPIs, that you'll be sued, you'll be discredited, you'll be embarrassed. And it just took doing it to show that it was a myth. But because I believe in the future, it's this transparency about our data that's going to help inform best practice.